siRNA therapy is one of the newest cholesterol treatments. The pathways for cholesterol have been studied pretty extensively, and so we're seeing drugs be developed that are targeting specific portions of those pathways. And the more specific they get, the better the effect will be and the more precise. siRNA is a subtype of drugs to treat high cholesterol by targeting PCSK9 formation. PCSK9 is a protein, and when there are high levels of PCSK9 floating in your circulation, it increases your LDL or bad cholesterol levels. siRNA stands for small interfering RNA, and RNA are proteins that are like messengers that carry information around the body about what to make and not make. And so by targeting these RNA messenger molecules, we prevent the formation of PCSK9, which thereby lowers LDL. The treatment schedule for siRNA therapy involves a baseline injection followed by a 3-month injection, and then after that, it's every 6 months. So in fact, it's actually very infrequent and takes out this sort of remembering to take a drug every day. PCSK9 inhibitors and siRNA therapy are really intended for people who either don't tolerate a statin or who haven't achieved their LDL goal on a statin. And these are people whose cholesterol is either very, very elevated or who've had very intense side effects from statin therapy. I mean, I've had patients who really can't tolerate statin and have had significant muscle pain, and so we've switched them to PCSK9 inhibitors, and they've done very well, lowered their LDL cholesterol with no symptoms. There are so many great new advances in medical therapy for all diseases, but the ones coming out for cardiovascular disease are especially exciting. If the first one we try doesn't work, we try another, we could try a third, and then we can move to an entirely different class of medication. There's always something we'll be able to use, and we'll be able to get people's cholesterol down effectively.